Good morning, Gary Pace, Public Health Officer of the county. Thank you for giving me the opportunity to talk. I want to talk a coronavirus update again. And I know this is on people's mind. We're all watching the news, and I think Sheriff Martin's going to chime in on it as well. And I think we're probably going to go ahead and make this a regular item on the agenda so that I can just kind of come in and give an update if there's anything to give. It's moving faster than I think we anticipated, and so there's just more going on all the time. Basically, it's, as everybody's aware, it's spreading. There's becoming pockets of activity around the country, and I think this is probably going to continue to expand. It's probably out in the community significantly in different places. At this point in Lake County, there's no cases, there's no there's no known community spread, but we haven't really done any testing here because nobody in the county has met the criteria for testing, and the CDC has had very limited, very constricted protocols on who can get tested and who can't. That's going to change probably this week and into next week, where there's going to be much more availability of testing, and so they're going to loosen some of the restrictions, so we're going to get more a better sense of actually who's infected and what's going on out there. But at this point, we don't have any significant concerns in the county about infection or community spread. We're not seeing a huge spike in disease activity or anything like that at this point. Just to talk about what the preparations in the county are, we have opened the DOC at the health department now, so we're meeting daily. We're going to we're basically working at our desk, but we're communicating daily around this, and we're in communication with the healthcare providers and some of the other agencies around the area. There is, we had a public forum last night that we got invited to speak, and there was a panel. Sheriff Martin was there, Chief Dowdy for EMS, Rob Young with the schools, and some of the folks from Sutter. I think that was everybody, right? And Dr. Page from Sutter, right? So Dr. Page, and then Teresa Campbell, who's the Director of Nursing, and then Tammy Carter, who's the Infectious Control Nurse. So they were all there, and we basically talked a little bit about what each of the agencies is doing for preparation. And Sam says at this point there's like 8,000 hits on the Facebook page or something. So people are watching us. Supervisor Scott was there, so thank you. And I think a big part of this right now is trying to communicate to the public and trying to just have people aware in preparation without, and so it's a little tricky to talk about it, so that because we're trying not to, we don't want to induce panic, because at this point there's no infection in the area, but we're also trying to encourage people to get prepared and to sort of think ahead, because most likely it's going to come, and then how serious it's going to be, we just don't know. There was a couple cases, I think, in Sonoma County. They basically shut down a school yesterday for at least a day. I don't know how long that's going to go on for. And Sonoma County has declared an emergency there. Several of the Bay Area counties have declared either health emergencies or emergencies. Napa has not, Mendocino has not, we have not, but I think the question will come up periodically, and I think the other counties are kind of looking for more support so that the state will end up declaring an emergency. I think there's going to be more of these sort of questions about school closure and limiting large public gatherings, and so that's going to be happening more and more in the Bay Area. And, we'll give our recommendations, and people are going to do what they're going to do. The travel question, I think, in my opinion, this is probably going to continue to evolve and get worse. I think it looks like some airlines are reimbursing, others are not at this point. And so, if you buy a ticket, you're taking a risk that you may eat the ticket. I think, I don't know at this point that I'd be so concerned about actually getting sick on the plane. That wouldn't be what I'd be thinking, but it's possible you might get stranded someplace. I think as things are changing, they're going to be unusual interventions are going to be happening that you can't anticipate. And what it's going to be like in a month, or I didn't quite catch the date, but a month or two, we don't know. So and I think if anybody's thinking about traveling internationally, just look on the CDC website for what the recommendations are about that. So I mean, I guess unless there's any questions, I'll just kind of come back weekly if people want to know. I guess the one other thing is I'm particularly interested in the elderly population now. That seems to be the folks that are the most vulnerable. And I think probably really the best thing we can offer at this point is preparation. So I'm hoping to get out and talk to the nursing facilities and maybe go to the senior center or get on the radio or something on the senior program that is out there. So that's kind of the general. And there's also, just to emphasize the individual activity that can be done, hand washing, covering your mouth when you're coughing. It's airborne, and so anything people can do to wash their hands more regularly, cover their mouth if they're coughing, stay away from people that are sick. If people are sick, to stay out of public. So I think that's it. Thank you.
Where can the public find the information for best practices, other stuff like that?
So the best information is on, we're I think today or tomorrow are gonna get some of the links on the health department webpage. The place where we get the information is either from the CDPH website, which is California Department of Public Health. And when you hit that webpage, there's a coronavirus, and you hit that, and then you can get all the stuff. But most of that information is coming from the Center for Disease Control. So the Center for Disease Control has a very good website. It's a little complex, so sometimes it's a little hard to find it. We're going to put the links on our webpage so people can just go in and click on it. But that's kind of the way to get the information.
All right. Thanks. Thank you.